The Uganda AIDS Commission joins the rest of the world to celebrate the International Candlelight Day, remembering those who passed on and standing with those who lost their loved ones. This was addressed during a media engagement in Kampala today.
This commemoration, as you very well know, is an international event. It is the Candlelight Memorial Day is commemorated internationally. And for our case, as Uganda, it will be commemorated here in Kampala at the Uganda AIDS Commission head office in Ntinda.
This year's theme is Ending AIDS by 2030, Building a Sustainable Response. HIV continues to be a major problem in the country, with new infections each year, and according to Dr. Vincent Bagambe, over 1 million Ugandans are currently living with HIV, attributing a third of the new HIV infections to being the youth.
We are here to tell you that HIV is still with us. We have 1,490,000 people, Ugandans living with HIV. And each year, we get new HIV infections, 38,000. That is close to 1,000 people per week. And therefore, one cannot say that it is not a problem when we are still getting that number of new HIV infections. We get close to 20,000 AIDS-related deaths each year. Also to note that of the 38,000 new HIV infections, over a third, call it the majority, are our young people.
He added that despite the US aid fund cut that took a toll on the country, all health facilities continue to provide HIV services, asserting that there is enough medicine for patients, urging them to continue receiving services.
We have had a series of meetings. We have agreed with the partners to ensure that services are not disrupted. And so in the period of the 3 months that we've been through this period of uncertainty, all government health facilities and all faith-based health facilities and non-government hospitals have continued to offer HIV services. I want to also assure you that we've taken stock, and we are sure and we can assure you that we have enough stocks of drugs and health supplies for management of HIV services.
In an effort to see a population free from HIV and an aim of ending HIV by 2030, the Commission developed strategic goals to ensure the prevention of HIV and AIDS spread across the country.
That's our goal. We want a population that is free of HIV and its effects. So we develop policies and plans and strategies. We are in the middle of developing the strategy for the next 5 years nationally and also for our own work with Uganda AIDS Commission. So we want to reduce new HIV infections, increase the proportion of people living with HIV so that they can, not increase their proportion, but the people living with HIV to be able to access services and adhere to care and treatment.
The youth were also empowered to take action in ensuring proper information is acquired regarding HIV. They were also called upon to join in the commemoration of the International Candlelight Day and join in the fight against HIV.
We want to call upon young people to get empowered to take action. When you don't have accurate information, you have little to say. And when you have little to say, you'll have no space. Let us get empowered. Let's get correct information. Let's understand what we are dealing with in order to meaningfully engage with our stakeholders and other partners. But most importantly, let this be a moment that you are reawakened, that you remain conscious and sober to the fact that HIV is still with us. And let this be an opportunity for us to know that when we join hands together, we can meaningfully contribute towards the attainment and the achievement of Vision 2030.